Hi, it's Dr. Noel Williams, Optimal Health Associates, November 2nd, 2021. I'm going to be doing a COVID update right now. I just did the depression one, which we're going to post tomorrow. So COVID, it's going down. We were down to about 600 cases yesterday in Oklahoma. Hospitalizations are going down. It's seeming to be over with the Delta. It will continue to go down. And before anyone yells at me or criticizes that comment, I don't know if that's going to be it. I don't know if we're going to be over, but since it's going down, I think we can feel comfortable that this variant surge has come to an end. It doesn't mean we're not going to have another variant surge of some type, but it is very unlikely that we'll have as big of an event again. Again, you can later say, well, you were wrong again. That's okay. I'm allowed to be wrong again because we don't know. But if you just look at the pattern of the science, which has been completely thrown out, and parenthetically, I'm going to comment that I feel completely defeated by, by the abandonment of science, and I'll explain why in a minute. But anyway, so the bottom line is this. If you look at the Qatar data, you look at data out of Italy, the true reinfection data going into Delta that caused hospitalization was minute in prior infected people. They are herd immune. They may not be completely herd immune, but they're pretty herd immune as a group. You look at the number of people who've gotten Delta, they're covered against Delta if they were prior, or if they were someone who hadn't been infected and hadn't been vaccinated. That group's immune. We've never seen a prior infected person in July, August, September, October. In 4 months with more than 400 Delta infections, we have not had a prior infected person who wasn't vaccinated turn up with Delta. Maybe it's a one-off, who knows? But it certainly matches the data, excluding the crap that comes out of the CDC, which isn't data, it's meaningless. But anyway, so if you look at prior infected, recently infected, and then vaccinated, the people who, everyone around got exposed to Delta. And so if you didn't get infected when you were exposed to Delta because you were vaccinated and you were around people and you know you were around people with Delta, like I was multiple times, and then they'd pop positive that day or the next day, and I never got infected, I feel reasonably comfortable that my vaccination in combination with my immune system was effective at fighting off Delta or preventing infection. And since I followed my antibody levels and I never had a bump up, they've been completely rock steady. I don't think I would usually, you'd have an antibody bump if you got even an asymptomatic infection. But the point is, there's just this huge volume of vaccinated people now. We could always use more, but there's a huge volume of them. There's a huge volume of infected people. That is building towards herd immunity. And it's just going to limit whatever happens. What the CDC says that we need 99% of the population to be vaccinated or infected is just not true, because there's a baseline 20% immunity against COVID that has been already discussed and proven multiple times in papers. And I don't know what I can do about that because there's no science anymore, but it is what it is. So the point is, I think it's highly likely, unless there is another massive mutation on the level of Delta compared to Alpha and Beta, that we could be in good shape for a while. There is no possibility that we are going to have a surge again during the holidays. Delta's petering out, and there isn't any other variants getting here right now. So there will be, and we'll have to see what happens January, February, but the next variant surge is probably a couple months away before it all gets here, and we'll have to see if anything happens with it. But the bottom line is, things are stable, we're in good shape, take your vitamins, you're fine. Okay, now let's talk about some vaccine stuff. If you are an adult, you haven't been vaccinated, you haven't been infected, I still would encourage you to get the vaccine. I've talked about this with hundreds and hundreds of people. I'm supportive of people no matter what they decide. But the bottom line is, I still think if you are an adult, over 30, let's say, I think there's very little argument about getting vaccinated, just because there's too many people who have died in those age ranges. Yes, it's a minority, but it definitely happens. If you are someone who is thinking about a booster, again, that is your decision. I've kind of thrown in the towel on the boosters. There's no data supporting them. The people who were for it at this, or who led the program at the FDA, bailed once it got approved. There's editorials against it. It would be much more effective to take that vaccine that we're wasting on people getting boosters, send it overseas, and vaccinate everybody over there, so we're less likely to get some wicked, vicious variant from it mutating amongst unvaccinated people in third world countries. And that would be rational and meaningful. So that's my opinion on that. Childhood vaccination, I have a difficult enough time with people in their 20s getting it that it is really hard for me to have any semblance of support for an experimental vaccine that's getting approved. We do not know the long-term ramifications. I would take 5 years data. I'd be thrilled, but I'm just not seeing that there's any true safety data. We don't know. If you read all the stuff I read, the trend of the data or the reporting is, and you listen to what Walensky says, and you look what Fauci says, it's about vaccinating the kids to limit the infections in adults. I don't think we do that. I don't think we do it. There's risks to the vaccine. It is totally okay with me if you get your kids vaccinated. You have to make your own decision as a parent, but you have to look at it very carefully, because kids just don't get that sick. Yes, kids get sick from COVID, but on average, it's minuscule. And you have to look at, we have no idea what this is going to do. We don't know what it's going to do to the immune system of these kids. We don't know. So I think, again, you use a vaccine where it's needed. The obvious person, me. People older than me, men, really over 25 to 30, absolutely. Girls pretty much the same way, or at least over 30. Anyone who's pregnant, because again, pregnancy is a disaster. If you get COVID, your vascular permeability is different. It's kind of the opposite that, people worry about, could it cause miscarriage or something? I would worry much more about if you get COVID when you have pregnancy, going into septic shock and dying, because it happens and it's very awful. But again, these are hard questions and there's no simple solutions. So that's where I am on that stuff. What am I missing, Kim? Was there anything else I needed to talk about tonight? But I'm really pretty positive we're in good shape. I just feel like with the science stuff, there was a CDC paper that was the weekly morbidity and mortality report that claimed that you were 5 times more likely to get infected if you had a prior infection. I read that paper 5 times. The last 3 times, each time took me about 20 to 30 minutes. I went through it line by line with another doctor. Twice, we could not make heads or tails out of how they came up with any of their statistics. It was completely the other doctor said, this is the most confusing article I've read in my career. It makes no sense. And this is someone who's in a journal club monthly and still does statistics. He could not understand it in terms of where they came, any of their conclusions. I can't either. It goes against all the data. I don't know what else to say. I mean, you look at the Qatar data, going into Delta, they had 1 hospitalization out of 125,000 prior infected patients. They didn't give the purport, I can't remember how many actually got reinfected. It was tiny. Out of the Italian experience in northern Italy, over a couple 100,000 people who were infected, they had 2,000 people get reinfected and 1 patient get hospitalized briefly. There's the data I've talked about in the pediatric group, which showed they were 99% immune at 1 year. There was an adult study that showed they were 99% at 1 year. I'm just not seeing where we're getting this hoofbeats that prior infected people need to get vaccinated. I don't see real data, a real paper, anything showing statistically there's an improvement. I would love them to do a study showing that, but they won't do a study on it because they don't want to. So I'll stop complaining. But I feel a little defeated by all the lack of science, and there's nothing I can do about it at this point. So you all have to make your own decisions, and I'll give you the data I can. So take care. Good night. Oh, depression tomorrow.